You're 7 o'clock, and joining us in studio this morning from Lovelace, the specialty healthcare, Regina Smith. It's certified nurse practitioner. What's the F stand for? Family nurse
Yes,
practitioner.
sir.
There you go. I always get messed up on the initials here, but family nurse practitioner. Good morning. How are you today?
Good morning. I'm awesome. Thank you.
Well, we're back and probably talking about a subject that we all need to talk about that everyone kind of, pushes off a little bit or delays. But we do want to remind folks that, the importance of colonoscopies. And I know no one's lining up to have people go right up the back end there and check things out. No one's like, I can't wait for that. But in terms of how much benefit your life has, it's definitely a pretty simple thing to and trust me, as someone who's just gone through this in the last year or so here, it's a big deal. Colonoscopies. Last time we talked to you, I think it was right around the time. Well, maybe they were kind of starting to get the word out that, hey, 45 is the new screening age for getting colonoscopies and things like that.
Yes.
And I'm sure to be honest, I'm 49, and I went and got mine done because of it. I said, and they found like a half dozen polyps back there. So they got a baker's half dozen in there.
Sure.
Polyps.
Yes.
And so they had to do a couple surgeries to get rid of them, but they're gone, and now I'm good to go. In like 3 years from now, I got to go back because I had 6 of them. They're going to want me to come back every 3 years instead of whatever the normally is. But I'm 49, and what happens if I waited, longer? So I'm proof in the pudding. 45. Go get the screening done. It's not that big a deal, and it really is the best way when it comes to colon cancer and those types of things. This is the way to prevent that kind of stuff from happening.
Absolutely.
Yeah.
Absolutely. And 45, I wanted to explain, 45 is for a person of average risk.
Okay. So if you've got a family history or something or higher risk, you probably should be doing sooner than that.
Yes. So the guidelines pretty much state if your father, say, was diagnosed with colon cancer at age 40.
Okay.
10 years prior to that, you need to be having your first colonoscopy. So that would be 30.
Okay.
So we see a lot of young people that have first-degree relatives that have had colon cancer come in much earlier. So, yes.
Well, and here's the good news. In the world of cancer, generally colon cancer is one of the more slower-moving cancers. That's why the colonoscopy is the best source for that, because generally speaking, they find something and they find a polyp that's got the right recipe or already has started doing that, they can nip it, pardon the pun, nip it in the bud here pretty quick.
Yes.
And it's not where it's going. But going on check, it will kill you.
Absolutely.
Absolutely. And to be honest, this is where I don't want to get but don't do what Steve Jobs did.
Right.
Steve Jobs died of colon cancer, and he didn't have, there's 2 different types there's one that's more aggressive, and then there's the one that most people get that's a slow.
Sure.
He had the latter, the slower one. But rather than going with the doctor's advice, he was doing a lot of his own stuff and doing things that hindered and did not help he'd probably still be with us today if he listened to his doctor.
Absolutely.
And so don't go that route. Don't try, the doctors and nurses and everybody, especially Lovelace, they're pretty good at this now. They know exactly what's going on. Trust their expertise. Let them go in there and do. And I guarantee you won't have a Steve Jobs problem.
Exactly.
That's I know, because that's a famous case and everyone knows about that. And he died. He's one of the few that I think you could say die of colon cancer now, because we're at a point now with, if people are getting their screenings, nobody should be dying of this, because they should be able to catch it early. And it's a minor inconvenience in your life.
It's a very simple process, quite honestly. Years ago, we used to talk about, and everybody would joke about, you have to drink a gallon of stuff to clean you out, and it takes forever. And it's not like that anymore.
Yeah.
At all.
Don't get me wrong. Your prep work is probably the hardest part of the entire procedure, but generally speaking, and if yours is a little different, please tell me, but this is kind of what I did. It was basically they, that day before, you take 4 of the, I think it's Dulcolax, which are a pill, a laxative, which you normally would not take 4, but you take 4 in this. And then a couple hours later, you'll start drinking Gatorade mixed with like a Miralax or something along those
Absolutely.
lines, and then you drink about one of those 30 the bigger bottles of it,
Sure,
whatever,
sure.
over the course of a couple hours. You'll drink about 8 ounces every 15, 20 minutes or so.
Sure.
And it tastes like Gatorade. So you're drinking Gatorade, pretty
Absolutely.
regularly. And then somewhere during that process, you're going to feel a rumble, and then you're just going to move into the bathroom until everything clears out.
Exactly.
Take a book, take your iPad, and watch a movie, whatever it is you got to do.
Yes, yes.
And then about that night, you clear. And then that rest of the day, you're obviously on a liquid diet of drinking, water and fluids. You can eat and I say eat. You can eat like bone broth.
Sure.
As long as it's not red or purple, things
Red,
that look like
purple, or
blood.
orange. Right. We don't want to dye your intestine.
You can eat popsicles and stuff. Generally,
Absolutely.
they let you do that kind of, as long as they're not red or orange or because they get nervous when they see red things in your.
Exactly. Exactly.
But and then in the surgery itself, it's very pleasant. I mean, you go in there. They put you to sleep. You wake up. You feel refreshed. You need the day to kind of, because you've been under anesthesia, so they don't want you operating heavy machinery. But you go home, chill for the rest of the day, and you're back to work the next day like normal.
Exactly. It's a painless process, and quite honestly, it takes usually 10 to 20 minutes. I mean,
yeah.
When
they were in a little longer than me because they were doing work back there, but
Sure.
The last one, I think I was in and out in like 40 minutes. Like I woke up and everything, and they're like, "Oh yeah, it's only 8 o'clock." Or I was like, "Man,
Absolutely.
just started like half hour ago."
Absolutely. And while they're there, and you make a very good point, while they're there, they go ahead and get polyps that could be precancerous. And we look at the different types of polyps and, determine, when do you need to come back by the different types of polyps. They're all sent off for pathology. We're able to tell, this is precancerous. This is more dangerous than this kind.
This
And
one's
it's
just a garden variety one. Yeah.
It's very personalized. This is not a we run you through the mill type of thing,
Yeah.
And that's very important because, when we talk about cancer is cancer, whether it's breast cancer, whether it's brain cancer, whether it's colon cancer.
Yeah, whether it's
Cancer's
slow or
scary.
fast, it's a
the
scary
C
word.
word's scary, right? So, and, people don't like to talk about going and getting a colonoscopy. It's not the fun thing to go
Oh,
do.
yeah.
But it's necessary,
Absolutely.
because it's a reality.
And I promise you this: if your fears, and I get it, you're being knocked out. That's a lot. It's a different world for most people. The doctors and staff, they do this every day, and it's. I mean, don't get me wrong. They pay attention to detail and everything else, but in their world, these are routine procedures. This is something they do. I don't know. You and the doctors probably do what? A dozen of these a day or something. I have no idea how long they take, but on average, they do multiple ones of these a day, all day.
Well, Dr. Torres is our surgeon that does the colonoscopies. He's been doing this for many, many, many years. So has a lot of experience.
Yeah.
Yes, he's able to do quite a few in the day.
And you're the one that they probably initially meet with and talk to.
Absolutely,
and
in
then,
the office.
And then usually the aftercare when they talk about the results and things. And then Regina's the one that you sit with.
Absolutely.
And you go over the numbers and go with it and the follow on and the aftercare.
Sure.
And that's kind of your job in that world is you're the one who talks to the patient, deals. I mean, the surgeon talks to you and answers all your questions, but generally they're going from surgery to surgery, and then
Correct.
Regina's here to come and make sure you're taken care of,
Correct.
Before and after kind
Correct.
of thing.
And that's pretty much how that is. Dr. Torres does see people in the office, of course. So, of course, you could see and talk to him if you wish. That's not a problem. We work very well together. So, yes.
And here's the thing, because you're generally starving after your procedure, and that's kind of your reward is go anywhere you want for eat or breakfast, depending on the time of day you have it. And I'm just saying, if you're at Lovelace, just week on, you're going to be over at the hospital getting the surgery. Just go on down and have a burrito afterwards.
Oh, yeah.
Because they got the best burritos in town. He's laughing because I do this every single interview. I got to because it's kind of my jam now. But this is one of those ones that this is like peas and carrots goes right together where like you just had your colonoscopy. You don't even have to get in your car, mosey on down to the cafeteria, have you a breakfast burrito that's going to be great and satisfying, then have your caregiver take you home where you can rest and recoup the rest of the day.
That's right. It's an easy process, quite honestly.
And I'm not going to lie. Because both the multiple surgeries I had for it or colonoscopies I had, they're all early in the morning, like 6, 7 in the morning. So I generally come off a night's of sleep, and but generally it's one of I've been cleaning up the night before, so
Sure.
it's kind of. But I'll get there after a full night's sleep, go in there, do the surgery, and generally by 8:30 or whatever, you're done with the surgery. But after that, whatever the anesthesia it is, I feel like I've had a full night's sleep, like you've only been out an hour or whatever, but you feel like you've had a full 8 hours sleep rested. Like, you know what I'm talking about?
Sure.
Like you wake up and you're like, hey, it's going to be a good day here, was it?
Right,
yeah.
right.
I've never, I don't get that all the time, like waking up in the morning from your sleep, and it's so, but the 3-4 times I've gone to colonoscopies, I've had it each time,
Sure.
and I'm like, I kind of dig this little. It's kind of, when you wake up, you're just like, oh, I'm just waiting for birds to sing or something. Oh, maybe it's just my experience, but it was kind of nice.
Yes, it is. It is. So.
Yeah. So please get these things scheduled. If you have no family history,
Sure.
45 is the magic number.
And that's for average risk, 45.
Yeah.
And if no polyps are found, no problems are found, then your colonoscopy should be every 10 years.
Okay. But if they do find some, then they're going to probably schedule, unless they can get them all in that one time. That really depends on the scenario
and
there.
Usually, from what I've seen, they do.
Yeah.
They get them all.
I was different.
Yeah. You come, you meet with me, and then we discuss, okay, you have these types of polyps, so you need to come back in 3 years or 5 years or whatever.
Yeah.
So that we can watch these.
Yeah,
sure they don't return.
To me, it's almost like, and this is, I'm going to trivialize things, but I remember when I got the report and everything, it almost reminded me of like watching some 80s like cartoon where they're showing like the mug shots of like Dick Tracy bad guys, and they're like, this is this kind of cold polyp, and it's like fish face or something. He's a nasty one. But like, because I had like a couple, and then there was one or two that were like, these are the ones that were a little nervous about,
Sure,
but it reminded me because they had pictures, of each one and everything, and it was almost like a mug shot. It's like, Shifty Malone, he's a nasty one, and
Exactly.
that's what it reminded me of, that a little bit.
Exactly.
But yeah, they're like they say, they each one's got the type label, and they know exactly. Oh, this one's not a big deal. Or, no, this one, these are the type that develop into cancer if go untreated, and that's what they're looking for. There's certain polyps that are the ones that are just welcoming for cancer, and others aren't, and that's where they know the difference, and they clean them all out because you don't want polyps in there. They don't want you gumming up the process, so they remove them all. But that's where they. And then once that happens, then you generally, like you said, if you have 0, then it's 10 years. But once they get like I said, I had a plethora of polyps, and and after all said and done, I don't go back. I go once every 3 years, which is it's not bad.
And one thing I do need to explain is, and I'm sure you can validate this, if you've got polyps, you don't know that you've got polyps.
You don't. You can't.
They're silent.
Yeah, I don't.
And these are the things that can turn cancerous. So, I mean, that's the whole thing about this.
And this is what I asked, because I was like, well, why do I have 6 of them? Is it something I'm doing? And they said, not really. It's there's a lot of variables, but really there's nothing you can do or not do to either increase or decrease your chances of polyps. It just happens. Obviously a family history thing is generally an indicator. If your family has them, odds are pretty good you're going to be getting them too. But other than that, is it my diet? Not really. That contributes to other factors, but not polyps.
Sure.
So if you've been eating cheeseburgers, that's not that, or been eating salad your whole life, it's no rhyme or reason here.
Sure.
So that's why it's so important for everyone to go. If you don't have a history, then 45. If you do, then earlier than that.
Yes, the family history, please. If you have a family member of first degree, mother, father, is what we're looking at, that has had colon cancer, please make an appointment, get in somewhere, get this done, come see us. We need to check this out because some people may have to have their first colonoscopy at age 20.
Yeah.
I mean, literally.
Yeah.
So we really need to look at this. And these come from very, very, very strong guidelines that have been studied and researched. So it's not just something we pulled out of the air.
So let me ask this too, because this is something you guys deal with a lot too, is, people getting their colonoscopies, but some also get the other side at the
endoscopy.
GI and everything.
Yes, sir.
What would be reasons why someone could do both at the same time?
Well, and we do a lot of those. Somebody that has chronic heartburn or reflux symptoms that's never been checked out, if that's never been checked out, that can actually turn cancerous on its own.
Okay. So
Okay.
that it's kind of like if you, I mean, I'm kind of curious, like for people that take like Prilosec, those types of things, are they more susceptible to that? Or, I mean,
It's
obviously
not-
they're taking it for a reason, but is that wearing away anything in there that actually...
that constant reflux of that acid can cause a change in the lining.
Gotcha.
Okay.
Because isn't that part with a valve or something that it's not opening,
The sphincter,
closing right?
right.
Yeah. Yeah.
It may be floppy.
Okay.
And there's other things that can be done. If that's a chronic problem, there's surgeries that can be done.
Okay.
For that, to help that.
Gotcha.
And we cover that too. That's something Dr. Torres does too. So, I mean,
yeah, that's all your scope of work there.
We can handle it all from the top to the bottom.
From the mouth to the anus and everything in between, you kind of got that, territory there.
If you've had chronic heartburn, you really need to get an endoscopy, and it's just as easy, if not easier, than the colonoscopy.
Is the prep a little easier on that one?
Of course, yes.
I've never had that one.
That one, you're just nothing by mouth after midnight.
Gotcha.
So, yeah, it's really no big deal.
Excellent. You're asleep for everything else, so it's a good deal.
Easy deal.
Yeah, but please get those appointments scheduled. Get an appointment with Regina and her office here. You can call direct. 575-625-3400.
Correct.
And of course, they're located on Country Club, 311 West Country Club, Suite 1 there, and not at the main hospital. You'll go there for the actual surgery.
Correct.
But for the prep work and the consultation and all that, you'll meet Regina at the office there on Country Club.
Correct.
And get that taken care of. And even if you're not sure if you need a colon, maybe you're just having issues like acid reflux, or you're having digestive issues, diarrhea or constipation, things like that. Some of the minor stuff, talk with your primary care, but they may say, you know what, you need to go and talk to a specialist here, and let's get that looked at. But even if you don't have to, but if you're dealing with those kind of issues, you can make an appointment direct with the office there.
Absolutely.
And they'll get a take a look. And you may not need a GI or a colonoscopy or nothing, but they'll at least give you options on what you have and what we can do to help you.
Exactly. So it's full service for all of it, yes.
And that's the kind of stuff that, you don't want to be dealing, because that's the quality of life type stuff.
Exactly.
You know what I mean? That's the kind of stuff when every time you eat a meal, the next thing you know, you're in pain every time you try to go to bed.
And we have a lot of people that come and see us for issues like this. Yeah. So, yes.
But don't delay on the colonoscopy stuff. I know you get in there, especially young people, because I know you think you're indestructible. I was young like you too, and thought you're in your 20s, and there's a heart attack. That's years away. Colon stuff, strokes. That's all in the way, and not on my radar. A, it gets faster. You get older faster than you think.
Absolutely.
B, especially in the world of colon cancer and all this, it doesn't care how old you are. If the ingredients are the ingredients, get it checked out. If check with your moms and your dads and your uncles and grandparents, what's their history, and if they too were dealing with colon cancer or those kind of issues, then you need to talk to your doctors and say, hey, is it a good idea to me to get these? And talk to your primary care if you want a second opinion. They'll probably tell you, yeah, you probably should do it sooner rather than later. And then make that appointment.
Absolutely.
And make that, get the consultation. And that's where the great part is Regina, you'll sit down and kind of go over everything with them. So, because I think unknown is our biggest fear a lot of times when it comes to especially medical. If you don't know what they're doing to you, that makes you a little nervous, And so for you to kind of explain the whole thing, it makes it like a cakewalk, and it really is. It's so important, but it's so easy.
Absolutely, and I'm here. That's what I do. I'm here to make you comfortable about it, answer any of your questions, go through it step by step with you.
Yeah.
So by the time that we're done, you're going to have a much better level of comfort with it.
And I'm telling you, it really I will tell you this, after the second surgery when they did remove a bunch of polyps, I was in a little bit of discomfort for a day or two, but they were doing some work back there.
Mm-hmm.
For the typical stuff like that, you don't feel a thing. You don't notice a thing.
No,
You're
don't.
good to go. With that one, I had some bleeding and things for a couple of days, but that was because they were, like I said, they were doing some work in there.
Sure.
And
right.
they put their hard hats on and get in there. But and that's why. But even after that, a couple of days, I was fine. And then when I had one, the one after, about 6 months later or whatever, to finish the job up, that was easy peasy, real like the normal colonoscopy was the first time. So So the only time I had any kind of a little bit of rough afterwards for a day or two was when they pulled a half dozen, or I don't think they did all 6 at that time, but they did a good majority of them at that one time, and that's a little bit of work, but that was it. And I'm the extreme case there. If you're normal and average, you're not dealing with any of that.
Oh
stuff,
no,
so.
not at all.
Yeah,
not at all.
And if you get 1 or 2, it's no big deal. It really isn't. It's not the end of. This is why, because you had a colonoscopy in your 40s instead of your 60s or 70s for the first time, and because at that point, finding something like that, a little polyp wouldn't be, but that's probably not what you're seeing at that point in someone's life. You're seeing something that's more developed, more maybe cancer at that point.
It's absolutely possible, yes.
Yeah.
Yes.
So that's the trick here. It's colon cancer. It can be common, but it's very slow moving, which makes it easily treatable if you catch it in time.
And it can be very silent.
Yes, that's the thing. You don't feel issues. You feel normal until it's too late, till it's so big and to the point where it's impacting and blocking things.
Exactly.
And then once it's at that level, then it's a serious issue, and we're worried about your life at that point.
It absolutely is.
So don't let it get to that point.
Exactly.
Just make it easy.
Come see me.
When you turn 45, schedule that appointment, just like for women with your mammograms or your heart tests and those. When you hit those milestones in your life, to get these things done, 45 is the one, and this is for everyone, men, women. If you have a colon, which we all do,
exactly,
then you need to schedule this colonoscopy.
And if you need to schedule before that because of family history, please, talk with your primary. If you don't have a primary, call our office
and ask.
We will get you in. We will get you taken care of.
Yeah, don't just ignore it. It's too easy to make this not a big deal for you to do that. But please call the office direct, 575-625-3400, or come by for a visit, 311 West Country Club Road, Suite 1.
Sure.
And come on by, and Lovelace has got you covered with everything else too. If you're dealing with any other issues, come on by to the specialty healthcare clinic or any of the facilities that are part of the Lovelace group here, and they got you covered.
Exactly.
I know we're in the fall here, and people, still looking at other preventative care things, mammograms. Please, I know the world of COVID's probably put a little of that on hiatus for a while, but we're past all that. You need to be back checking with your doctors, getting your regular visits, and don't be not taking care of those appointments, things like that. That's the trick with this and anything else. It's having that relationship with your healthcare professionals so that you are on the same page and working together in concert, as opposed to. And that's I think a lot of people need to, when the doctors and the nurses and everyone give you that information to talk about, they're not doing it as a, all right, you got to do this or you're going to die or you're going to be sick kind of thing. Look, they're trying to figure out a problem, and they're working with you on figuring out that problem. And if you look at it in terms of, this is me going to either take this and die or not take this and die, then it's a whole different. But if you're looking at it as like, hey, we've got a mystery to solve here. Something's not working right. We've got to fix it. It's no different than you're talking to your mechanic, and the mechanic's like, I'm not sure if that's the road radio. Is that a muffler or is that an exhaust thing or what? We're talking about. It's no different with your healthcare professionals. They're saying, all the indicators point to us that it's a muffler, but it might be the exhaust. You know what I mean? And that's that. If you think of it in that term of relationship, like, hey, you're working together to try to pinpoint a problem and ultimately fix it, then you're going to understand that doctor and nurse and patient relationship much better.
Absolutely.
And that's where you come from there, as opposed to, I'm just scared you're going to stick me with that or poke me with that or put that somewhere I don't want it to go.
Exactly.
and change your mindset about it a little bit that
sure.
way. So, is there any information you wanted to share that I just skipped over?
I just wanted to let everybody know that Lovelace also, like what you brought up, we've got our specialty clinic. We've got our primary care clinic, which is very, very big, very, very busy.
Yeah.
But easy to get into.
Sure.
We've got an orthopedic clinic. So Lovelace is, like you were talking about, full spectrum.
Yeah.
So we can help you out. All you need to do is give us a call.
And the great part is, you work with Eastern and other hospitals, so your doctors so even if you have a doctor over here in your primary care, but you want the Lovelace folks looking at you for the colon, they work hand in hand and all that stuff. So don't feel like you're obligated to one or the other because that's where your doc. Go where you want to go. That's
absolutely.
And they'll work with you and take care of you.
And you will meet me in the office, and I will be the face that you see when you come in.
Yeah.
And then after your colonoscopy or your procedure,
Regina's going to be your guide through the colonoscopy.
I will guide you through this.
She will be taking you down the yellow brick road as you go through and guiding you through all the steps and easing any fears or issues you have and basically by the time you're done with her, it's going to be a no big deal for you. You're going to be like, oh, this is what I'm worried about. It's like, yeah, the only thing that stinks is you're going to be stuck on a toilet for a few hours on the day before. That's the only part. Is you're going to be like, wow, where did that come from?
Sure. But, honestly, it's a really small price to pay.
It is.
To have some insurance, that you're doing well or that you do need to have something looked at differently.
And if you got a busy, chaotic life, look at it glass half full. You're going to have hours to yourself the day before where no one's going to be harassing you, knocking your door, phone calling. You'll be like, look, I'm indisposed, and you got you time for 3 hours.
Absolutely, absolutely, yes.
But again, folks, if you have any questions or want to get a colonoscopy scheduled, or just you've got some healthcare issues that involve with the digestive GI area, and you need that of a specialist to come take a look at you, don't hesitate to call. At 575-625-3400. That's Lovelace Specialty Care Health Clinic. I'll get that right. 311 West Country Club Road, Suite 1. Come on by. And that's also the same place for all the other, specialty doctors there as part of Lovelace too.
Sure.
So if you're going there to work on,
cardiology, whatever it is you need.
Yeah. They've got the specialists there that they'll take care of all that. And then get you ready for surgeries or whatever they got to do to fix you.
Yes.
So.
Yes, sir.
Good deal. One more time, 575-625-3400 or come by Lovelace Specialty Healthcare Clinic at 311 West Country Club Road, Suite 1. Come on by and then don't forget, after your appointment, go over to the hospital and have a burrito.
There you go. There you go.
Thank you very much. I'm sure you got a group of patients ready and waiting for you when you get to work here to ease their minds and get them ready for their colonoscopy.
Yes, sir. So, thank you.
Thank you very much. Have a great week, and we'll see you next time.
Be blessed. Thank you.
Thank you. All right, 7:51. Let's pause.